Hello, folks. Good evening, good evening, good evening. I will give it a second for folks to join. If you are on Facebook or if you are on YouTube, please make sure that you say hi when you join because I won't be able to see you if you don't. If you are on TikTok, what's up? Good to see you. Hello, what's up, Renewed Eye? Renee, what's up, Sharon B? Hello, Mary. Hello, DJ. Hello, Ava, Punky, Tam Bam. Good to see you guys. D Nice, Space Wolf, Gemini. Good to see everybody. What's up, Win Dixie, Diva Deb, Jack Smith? Good to see you as well. Lynn Cotton Kim, good to see you. What's up, Funny Face? How are you? Hey, Dana G. Good evening, everyone. So I know that I am damn near an hour late, but I made it. that is the thing that matters. I'm here. I made it. And there's a lot to talk about. What's up, Dirty Bad Bloggers? What's up, Joanna? You all know me. I don't like to go live unless I am like if I have all of my stuff together. And it took me a minute to find some of the things that I wanted to find because some of the links that used to exist had been changed or had been taken away. And so I needed to find information because I just need to have my ducks in a row before I get on here and talk about things. So I just want to do that. Hey, Cheryl, good to see you. Hello, Beach Bum Wannabe. What's up, Lisa? Hey, Allie Nicole. Hello, good evening, Blue Honey Pot. What's up, Nancy G? Hey, Tammy Lyons. Good to see you over there on Facebook. So, hey, Sherelle. Listen, if you're joining me on Facebook or on YouTube, please make sure that you say hi in the comments because I can't see you unless you like chat me. What's up, Conchita? Hey, Beth of Friends. Good to see you as well. I am not using like Facebook directly or YouTube directly. I'm using the streaming service. And the reason I'm doing that is because I need to share my screen during this. What's up, Punky? Hey, Coco. And hey, Jeff Kennedy. Good to see you. And because I need to be able to share shit because it's not Friday. That's why. Oh my God. Thank y'all. Y'all be keeping me together. So let me just say this. I need to be able to share my screen with you all. So I am not using the direct Facebook interface. So I can't see when you join. I can only see when you chat and when you speak. So just make sure you do that, right? Hey, Cindy, good to see you. So I am hoping very much so that lots of folks in Northeast Tennessee and Southwest Virginia do join. Hey, Tiny Dreamer, good to see you. I think I said hi to Gemini already. So yeah, I really, y'all know this one is a, hey, Ricky Curry, good to see you. Lisa, good to see you. I think I said hi to Lisa Feldman Medina. What's up, Celia B? Hey, hey, Jean Barber. Okay, great. I'm glad I did. Okay. So y'all, there's a lot for us to talk about. And I'm going to need everybody to be patient with me because I'm going to be, I'm kind of excited, not like excited as in like, I don't know, like yay excited. But the fact of the matter is that what's up, Tammy Anderson, is that national politics and ballot health are crossing streams. And this is a good thing for me because I get to connect the dots that I definitely try so hard to connect the dots where they are concerned and their involvement in politics and the impact of politics on ballot health and on the people of the region back home. And so this is an incredible opportunity that, quite frankly, only came about because of the actions of Ballad Health themselves. So appreciate you, Tony Keck. Appreciate you, Alan Levine. Appreciate you, Commissioner Alvarado. I appreciate you all for jabberty jabbing, running your mouths and making claims that, number one, aren't true, number two, are deceptive, and number three, are dangerous to the public. That is my personal opinion. I'm definitely entitled to it, but I'm also going to provide facts and data to back it up. So let's just go. Let's just go all the way in. Hello, Mama Dukes. What's up, Michelle T? So if you are on Facebook or YouTube and you are from Northeast Tennessee, Southwest Virginia, if you are on TikTok and you are from there, do me a favor. Please share this. Please tag your folks. Get people in here. And the reason why, what's up, Peacekeeper? Hey, Aline, good to see you, is because you all need to know what's happening. And I shared an article yesterday and I shared a little bit about it, but not enough. What's up, Just Nice? And so tonight I'm going to be going into detail about those things. And TikTok, you don't have this on your side, but Facebook and YouTube, you do. It says, tell the truth and shame the devil. So yeah. Yeah, a little sass tonight, a little sass tonight. Hey, Linda Sims, good to see you over there. All right, so here we go. Right, you like my title over there, guys? Anybody who knows me knows that I'm not a fan of Alan Levine, who is the CEO of Ballad Health. And it's not personal for me. It is I don't care for him in his professional capacity as a healthcare CEO. I don't believe that the choices that he makes with Ballad Health and the medical monopoly are in the best interest of people. I believe that it is solely and predominantly for the well-being of the corporation and its bottom line. And so I have a problem with that. I don't believe that the choices that he makes and the decisions that he makes are good for the people who work for him. I don't believe that they take care of their nurses and their providers. I believe that they bully people. That's my personal opinion. I believe that they bully people. I think there are, a couple of other people in the region and several state legislators who have said the same thing, that Alan Levine is a bully and that Ballad Health is a bully. And so we're going to talk about that. Hey, Michael. Hey, Valerie. I'm glad to see everybody. If I missed you, know that charge it to my head, not to my heart, or the fact that I'm looking at multiple screens. But it's definitely not because I wanted to. So what I want to do is just lay the groundwork for those of you all who maybe you're not familiar with Ballad Health. Maybe you're not familiar with what a COPA is, or how a legal medical monopoly could be created in your state. And for a lot of you all, it's because there's so much acquisition and merger happening within what's up, Sunlight, happening within healthcare, that people are like, yeah, we have that here, but you don't. So let me say this to you. Even if you're in a region where you only have one hospital and they are pretty much your only choice, you still don't have a monopoly that is a certificate of public advantage. You still don't have that. And I'm going to explain to you the difference. And then I'm going to call out some things that Ballad Health said. Appreciate you, Winn-Dixie, that I can show you, hey, witch, that are definitely lies. What's up, Brandy? Good to see you. And when I say, so y'all, it's very rare that I open my mouth outright and say to someone, you're a liar. But I'm going to tell you right now that Molly Luton, who is the spokesperson for Ballad Health, she made a claim in an article. Hey, Pin 1010. And yeah, no worries, Linda Sims. And she made a claim about Ballad Health, specifically with regard to their quality. And I'm going to tell you, and I'm going to show you from the data, that Molly Luton straight out lied to the people of Northeast Tennessee and Southwest Virginia. While I am from Northeast Tennessee, in my neighborhood, you could walk across the street and be in Virginia. Southwest Virginia has been devastated by the changes that have happened within our healthcare system. And it may only really get worse for folks in Southwest Virginia. I hear you, Cheryl. Got that. Great to see you too, Jamie Cobb. And so I really hope that my Southwest Virginia people are also watching. I hope that Roberta Thacker Oliver is watching. I hope that all of my folks in Southwest Virginia are watching. Susie Ford, I hope that you are watching. And I hope that you all remember that the two prominent politicians in Northeast Tennessee and Southwest Virginia that got you in this mess are Rusty Crowe and Terry Kilgore. So I want you to remember that. You only heard of Ballad for me. So do you mind me asking what county you're in, Cortina? Let me know what county you're in. So let me just say this to you all, okay? Virginia, you have an election coming up. You have a statewide election coming up. Yeah, so you're just outside. What's up, Receive Grace? Hey, Val. And so let me say this to Virginia folks. Hey, JD, thanks. Appreciate it. What's up, Dax? Southwest Virginia, you have an election coming up. This is one of the first times in a long time that every seat in Virginia is being challenged. Here's what I would offer to you. I want you to look up your people that are running for office. I want you to look up Terry Kilgore, look up O'Quinn, look up all over your folks in Southwest Virginia. And I want you to see if Alan Levine and the administrative level executives at Ballad Health are contributing lots of dollars to them. I want you to look and see if the PAC called Friends of Mountain States is sending them campaign contributions, because what I will tell you is they are. I've tracked it in the past. I can show it to you again now. And what I will say to you is this, is those damn politicians are not looking out for you. Get them out of office. Get them out of office and put people in office. I don't care what party they belong to. You put people in office that give a damn about you and that are going to stand up for you and your health care and your rights. That's what I want for you. That's what I have always wanted for you. And that's what we're going to do. So I'm going to just very quickly explain what a legal medical monopoly looks like. It is through a legislative mechanism. There's a law that allows two healthcare systems or two hospitals to merge together and become one entity. And the thing about that law and the thing about, hey, Doug, and the thing about that entity with this particular law. So, for example, in the state of Tennessee, our law specifically says you're running against Doug Quinn this election, Cindy Green for Virginia. Let's have a chat. I would be happy to bring you on a live with me, ask you some questions, talk to you, let you talk to people all day long, and be happy to do that. I would offer the same thing to O'Quinn as well. He just better be ready to answer my questions because I'm going to ask some hard ass questions. But absolutely, if O'Quinn wants to come on here, I've done this before and I will do it again. My platform is available to absolutely anyone that's running for office that wants to have a conversation with me and that is willing to tell the people about what you intend to do for them and how you intend to do it. What I will say is I'm going to ask hard questions, especially if you've already been in office and you haven't been getting the job done. If you've been in office and you've been selling your people out to major corporations, you better come with a good explanation as to what the fuck you've been doing for the people, because I'm going to ask you those things. I'm not going to sidestep it. I'm not going to step over you. I'm not going to give you easy street and a pass. I'm going to ask hard questions. If you are the incumbent, right? You have to be able to explain what you have and haven't done. Okay. Yeah, you're welcome, Cindy Green. Now, if you are the newcomer, right, we're going to talk about like what you want to do and how you plan on getting it done. I believe in realistic things for the public, not just pie in the sky promises. So, but I'm willing to do that for absolutely anybody. What's up, Cheryl? Right. Agreed. And so I'll make no bones about it. I don't care for the same way that I don't care for Alan Levine is the same way that I don't care for Rusty Crowe and the same way that I don't care for Terry Kilgore, because in my heart of hearts, I believe that their work demonstrates that they are out for themselves and not out for the people. And that's a problem for me. Okay. Hey girls, do me a favor, talk a little softer and close the blinds. All right. So here we go. All right. I want to dive in. So when this COPA law was granted, it said that it allowed these two healthcare systems to merge to become one entity. And it said specifically that the state was displacing competition in exchange for state oversight. And then it went on to say that it was giving this healthcare system, this new healthcare system, antitrust protections on a state and federal level, which means, it makes it very difficult for the FTC to come in and do anything to protect people. Now, here's my thing. Okay. They told people that this was necessary to save these hospitals, which was a lie. Not true, right? Not true at all. But I'm not going to go into that tonight. But here's my thing. If you are interested in doing good for the people, if you are doing everything above board, if your focus is on saving hospitals, improving access, and maintaining quality of care, why do you need antitrust protections? Share with me why you need antitrust protections if you are not going to abuse your position as the largest employer in the region. If you're not going to use your position, right, as the healthcare system that controls the majority of the hospitals in the entire region, in the main centralized part of the region, you control 97% of inpatient care. If you're not going to take advantage of that, if you're not going to exploit that, if you're not going to do things that you shouldn't be doing, why in the absolute hell do you need immunity? Yeah, that can just be rhetorical. I'm just going to let it sit out there. You don't got to answer it. I have my own ideas. But so let me just tell you this deal. So this happened, and they granted what is called a certificate of public advantage. And all that is it is basically a blanket, right? Um, and it says, yeah, you guys can merge, and here are the things that you say you're going to do. Um, well, just because they bought out a little system doesn't mean you have a COPA. I don't know that you have a COPA right now in San Angelo, Texas. I'm about to see if you do. And again, this is not about a merger. All right, so let me just look. Certificate of Public Advantage, you do have one. So let me tell you what this is. And I need to make sure that you all understand. I want to make sure that you understand what you have. Oh, I just looked it up. Now let me tell you what you have. Okay. It is not just that a big system bought a little system. It's not that you have a big system buying a little system. It's that you have a certificate of public advantage. And so what it says is that the benefits have to outweigh the anti-competitive effects of this merger of these people coming together. And everyone's is a little bit different. The thing that gets me, I don't know why the fuck they granted this for y'all. Oh my God, it just absolutely just does me in, because this is a situation where your COPA has already been granted, and it is so difficult to undo once they have been done. And if you undo them once they have been done, they can end up like Mission Hospital in Asheville, North Carolina, where they were bought by HCA, and then things got so horrible there that CMS gave them an immediate jeopardy and threatened to withdraw their accreditation, right? So a COPA is a bad thing. And the reason why I'm saying that is, in every circumstance where there's ever been a COPA in the history of this country, there are several things that have always happened. Number one, the quality of care has always gone down. Number two, the price of care has consistently gone up. And number three, employees have not had adequate pay or competitive pay along with the rest of the nation. There's oftentimes hardships for independent providers, and all of those types of things. So when you have a COPA, it is a horrible thing, and you have to stay on top of your Department of Health, because they are the folks that are supposed to be holding your healthcare system accountable for their performance. So that's the long and short of a COPA. Now, if you all did not see, I participated in an interview with KFF Health News. KFF Health News covers, hey Mary Shaw, covers healthcare for the entire country. And they have been covering stories and doing stories about Ballad Health since, like, I don't know, August, September of 2023, when Brett Kelman and Samantha Liss and I got connected together. And so I was approached. So we had new terms of certification come out. Hey, Blue Nevada, thank you. So listen, let me just say this. Terms of certification. I want you to think of a terms of certification like a contract. This is a contract between the health system and the Department of Health that says, because we allowed you to be a medical monopoly, because we allowed you to have immunity from antitrust violations, these are the things that you agree to do for this region. And you're going to be scored by this insanely complex rubric system. And depending upon how you do for that score will determine whether or not you get to stay a monopoly, right, under a COPA, whether or not we modify this COPA, whether or not we terminate this COPA and break you up. It absolutely did almost unalive you, Jerry Qualls. Yes. Yep. Ballad Health, absolutely almost unalive my good friend, Jerry Qualls, 100%. If you want to read and catch up on lots of Ballad Health stuff, you can Google me and Ballad Health. You can Google Ballad Health and KFF Health News, and you'll get a lot of different articles. But I want to talk about this latest article. And then I want to talk to you about how it got intertwined with national politics. Okay. So first, let me address the new terms of certification. Can I do that first? So whenever the new terms of certification come out, these are the new things that Ballad Health agrees to do with the Tennessee Department of Health. And subsequently, oftentimes it ends up being the same for Virginia. And Southwest Virginia people, you should be angrier than anyone about this, COPA. And I'm going to tell you why. Your Department of Health has done the least in terms of accountability. A couple of years ago, they hadn't even bothered to put out a damn annual report on Ballad Health for like 2 or 3 years. It was absolutely crazy. It is almost like the Commonwealth of Virginia decided to let the state of Tennessee lead and just come along for the ride. And the folks of Southwest West Virginia should be really pissed about that, because that's not your state looking out for you. That's not the Commonwealth doing what's in the best interest for you and your loved ones, right? So let me share this with you. So in these terms of certification, some things changed. And like Alan normally does, Alan's really good at PR. Let me just tell y'all this. Alan Levine is a smart man. He really is. He's a smart guy, and he can talk. Oh, he's good. Listen, he is a master at spin, or as he likes to say, he can filibuster really well, and he does. And for the average person who isn't dug in so deep with this monopoly to know what's going on, right? It sounds good. So Tammy, if your cousin has Medicare, what I would say to you is Kepro QIO is something that if you have Medicare while you are in the hospital and you are having problems with your quality of care while you're there, you can contact them. They are within, it's Kepro QIO. I'll get you a number. Are they in the hospital in Virginia or Tennessee, Tammy? Are they in the hospital in Tennessee or Virginia? These are things that I didn't know anything about. Okay, gotcha. All right, so let me help you. So Kepro QIO is where you can do. Let me get the right state for you. Kepro QIO phone number, Tennessee. All right. If they have Medicare, right? Here's the telephone number for Tennessee. It is, why does that look weird to me? 888-317-0751. Let me look and see if this is another one. Beneficiary and family-centered quality improvement contact, blah, 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 blah. Okay, let me give you a different one. Let me give you 844-430-9504. 844-430-9504. So that number specifically covers Tennessee along with several other states, Tammy, okay? All right. So let me go back to what I was saying. All right. Let me find you guys again. Oh, Alan is friends with Terry Kilgore on Facebook. That does not surprise me, Donna Williams, at all. You're very welcome. Can I spell that name? Yeah, Kepro, Kepro, and then it's QIO, Kepro QIO. So if you have Medicare and things like that, and you have problems while you are inpatient in the hospital, you can contact them, and they will actually contact the hospital while you're in the hospital with regard to your care. Okay. So let me just tell you. So Alan is really good at getting ahead of things. And so here's what happens is Alan Levine did an interview with WJHL. And let me just say this. Jeff Keeling is the only journalist in the Tri-Cities that I trust and think is worth a damn. He's the only person that pushes for the truth and wants to really hold people accountable and will go as far as his news station lets him go. So kudos to Jeff for this particular story, because he goes into a lot of the stuff about these new terms of certification. So May 7th, Ballad Health agrees to change to the changes in the terms of certification, right? And in the news release, the Tennessee Department of Health said the revisions cover 5 key areas: prioritizing quality of care, overall system scoring, rural hospitals, charity care, and listening sessions with the public. Now, if I could just stop right there for one moment and tell you, when we want to talk about listening sessions with the public, the Tennessee Department of Health was supposed to have an annual hearing with the public last June. Last June. Okay. They then postponed it for November. November has come and gone. They still have not held an annual public hearing. There has been one public hearing since, I believe, 2020. And it's supposed to be something that happens annually, right? So if we're talking about listening sessions with the public, I just don't believe you. I think it's horseshit. One moment. Hey, girls.
I'm not.
Okay, thank you. Do not. And please talk softly. All right.
My floaty face. No.
Yeah, you are welcome, Chris Brooks. You are welcome. And let me just tell you all this. If you want to do something, when KFF Health News does, thanks Mary for subscribing. When KFF Health News does a story about Ballad Health, they give their stories away for free. So you might want to inquire as to why not a single local media station in the Ballad Health Service region has shared that story, has ran that story. They give it away for free. Why would they not do that? Appreciate you for subscribing, Yolanda. All right, so here we go. So in this article, they're talking about these new terms of certification, right? And here's what it says. It says the health system's annual score from the Tennessee Department of Health, which is key to its continued operation, will now see quality of care count for 40%, and it used to count for 20%. Most of that 40% will be a pass-fail measure, right? One second. I'm not doing it today, girls. So stop it, whatever it is that's happening. So let me share this with you. Doesn't that, now that right there sounds great, right? We have often talked about the fact that of the system. So the way that it used to be, and of course I have the old and the new right here. Okay. So the old system, population health, that sub-index got 50% of the final score. Access to care was 30%, and other/quality was only 20%. The problem with it is that not only was it only 20%, but Ballad Health got a ton of credit, passing scores, for simply turning in those quality reports, no matter how they performed. Okay. So when you first see this new scoring system and you see that number has gone up to 40%, you think that's amazing. You're like, hell yeah. Thanks for hearing us, because quality should count for more. Please give her phone. Oh my God, I can't. This is the reason I spent the whole day at the pool, so that this would not happen tonight. Mila, stop fake crying. Yes, Cheryl, I do. Yeah, I do. She's already eaten. Give me 1 second. Hold on, folks.
Good evening, everybody. While we give Danny a minute to do the household things that we all have to do sometimes, keep remembering that you can tap the screen. As they say, tapping is clapping. And don't forget to give your heart for today at the top. You can tap there to send a heart. And don't forget that she has this amazing link tree with all this information, and you can find that if you go to her For You page. You can click on Danny's little face there. You can find her link tree in there, and there is an abundance of information in there. As they call it, instead of link tree, link forest, I think somebody coined it. So you can find all kinds of information in there. I'm sure she's got information in regards to ballot health and the stuff she's talking about now. And if not, if I know Danny, she'll be putting stuff in there for you guys. So you can help her out by doing that and sharing the live too. You good, Danny?
I am good. Listen,
Okay.
I am just like, oh my God. Like, I can't. Literally fighting over Minecraft. Dear God in heaven, could we just stop? But thank you, Cheryl. Appreciate you
You're
very
welcome.
much.
Anytime.
Thank you. All right, so here we go. So they got out in front of this and they want to tell you what a good thing this is, right? Let me tell you the rest of what Alan said, and then I'm going to tell you the truth, okay? So they were negotiating for quite a while last year, okay? And WJHL, along with KFF Health News, had gotten a hold of these email negotiations that were going back between Ballad Health and the Department of Health. Now, at the same time, the KFF Health News was working on another story. And so they spoke with me about the story. So in order for me to answer their questions, they shared those documents with me, right? Because if I was going to answer questions about those documents, then I needed to be able to see the documents to answer the questions. Thank you. And so I have seen the emails between, and I have the copies of the emails between Ballad Health and the Tennessee Department of Health. I can see where the Department of Health was asking for quality scores to be this number and Ballad Health saying, why don't they only be this number? I can see where they're negotiating and asking for things to be easier for Ballad to pass. I've seen it. I've read them with my own eyes, and I can share them with you, right? So this is one of those things where I actually know what in the flip I'm talking about and can back it up because I've seen them. I've literally read them myself to know what they said and what they didn't say. So anyway, News Channel 11, which is WJHL, had spoke to Alan Levine during those negotiations. And that was earlier this year. And so Alan had said, and this is what is in the article, it says, he said the final sticking points had more to do with language than significant differences. I don't believe that statement to be accurate, but that's what Alan said. And here's what he said, quote, fundamentally, we're all in agreement. We want to see access and quality of care be the guidepost for what we are doing here. And so that's what he said. And then he went on to say, quote, if you go to any rural community that's lost their hospital, first of all, mortality rates go up in that community. Well, let me just tell you something. We haven't lost hospitals, but our mortality rates of our hospitals under Ballad Health have gone up since they became Ballad Health. And I'm going to show you the receipts for that. And then he said this, the economy in that community suffers. Those are good paying jobs for that community. Access to physicians deteriorates dramatically because the hospital does support those physicians. So I think people in rural communities are very concerned about the loss of their hospitals, right? He's right about that, right? That's true, right? But again, let me just tell you, Ralph Alvarado has said a couple of times that this serves as a model for the region, for the country, and for the nation, right? And let me tell you something. It is a model about what you do not want in your hospitals. But let me keep going. So, where do I want to go on this? Okay, so Ballad released a statement shortly after the Department of Health released one. And here's what they says. Our goals are the same, Ballad's release reads, at a time when 150 rural hospitals have closed throughout the nation and 700 more have been identified as being in danger of closure. Keeping rural hospitals open for our communities is at the core of why the COPA was created. Access to high quality care is a goal everyone shares. Now, Ballad Health says that, and let me tell you this. They closed a hospital. They closed Mountain View Regional in Southwest Virginia in the last several years, and I can show you what that looks like. So let me pull up the right map that I have for you. Here we go. TikTok, give me a second. I'm going to show it to you too. But for you folks on YouTube and Facebook, this is the map of all hospital closures currently. Okay? So let me show you what this looks like for you. That's the one that I want. So, and I want to zoom in a little bit. And I want to go, whoop. It went really crazy. So do you see that? That is Mountain View Regional. Now, Ballad Health swears that this hospital is still open because you can call the damn phone and somebody will answer. But let me tell you what, this hospital is not open. It has closed. You cannot go there and get services. And it is showing as closed right here. So Mountain View Regional Hospital, Norton, Virginia, closed. When did it close? January 2020. And then it says the closure status converted. Converted into what? I don't really know. So when Alan talks about the loss of rural hospitals, right? That's one of them. The other hospital that they did was Tacoma. Tacoma Regional was also a rural hospital in Greenville, Tennessee. They quote unquote converted it and repurposed it as well, right? Into something else. So when they tell you, like I said, he's really good. He's really good, y'all, at the PR and at the talks. What is this on? It's on something. Sorry. And, but I'm just telling you, this is what's actually happened. And that's not the worst of it. So for those of you guys that are over there on YouTube and Facebook, you can see exactly what I'm talking about, right? Now, let me go back and talk a little bit more about what he said at that time, because he's a real good spinner. He really is. So let me just show you this. Yeah, there's lots of rural hospitals that have closed, and he's right. Not only are there 700 more rural hospitals that are at risk of closure, there are 300 of them that are at immediate risk of closure. Did you hear me? There are 700 rural hospitals in the country that are at risk of closure, and there are 300 of them that are at immediate risk of closure. By the way, rural hospitals account for 52% of all hospitals in this country. If you didn't know that, now you do. Yeah, Chris Brooks says you can drive by the open hospital, Mountain View, and on any given day, look at the parking lot and tell you that it is in fact closed. So again, I need for you all to understand this. Rural hospitals account for 52% of all hospitals. Now, I want you to remember that while we are talking about proposed Medicaid cuts. And then I'm going to tell you what Ballad Health said about those proposed Medicaid cuts. Appreciate you, Cam. So first, let me tell you what he kept telling about these terms of conditions. So listen at what the great spin guy says. So here's what he said. Our goals are the same at a time when, I already read that part. And then he said that was at the core of why the COPA was created. Access to high quality care is a goal everyone shares. So this is where it gets really, really dense. Okay. And I don't want to go into all of it, but here's what I will tell you is that, Ballad has failed over 80% of its quality measures for fiscal year 2022. 80%. They got credit for a ton of their scoring for simply turning their reports in, no matter how they performed at all. Okay? So let me tell you what Alan said about that. Quote, you can't just reduce quality neatly into 17 measures. And that's one of the advocacies that we've had with the state is you've got to have a way of pulling in those things that demonstrate that we've actually improved outcomes and improved quality, Levine said during the negotiations. So they said they eventually met in the middle, with Ballad seeing a higher portion of its annual COPA score come from quality benchmarks, right? But I'm going to talk to you about what those are. There are 24 measures that are on the benchmarks, right? And that now accounts for 32 points of Ballad's total score, which used to be just 5 points previously, right? However, during the negotiations, Ballad had proposed 34 points total in the quality category instead of 24, with 18 of those being based on just improving measures. And we'll talk about, I'm going to get a little bit more in depth with this in a minute. But I want you to hear something that he says. Oh gosh, I have a hard time reading his stuff. No, it's 24 is where they settled. So listen to this. This is what he said, quote, we think that there's very real and important improvements in quality that ought to be reviewed, and that I think the vast majority of people would agree are relevant, he added. The department said, the Tennessee Department of Health said that with COVID over, quality protocols should, quote unquote, be fully reinstated and Ballad's quality performance and patient satisfaction scores improve. It noted some improvement in fiscal year 2024, but, quote, recommends focusing on national quality rating organizations to sharpen the system's quality of care improvement efforts. This is what Levine had to say. Quote, what I'm concerned about is everybody that comes into one of our hospitals or one of our care sites, they're getting competent care from people who are highly qualified to deliver that care. It's being done in a way that's respectful, and we want the outcome to be good every time, he said. I'm not going to go into some of this other part. You can read it. I will put all of this in the link tree. But this is the part that I really want to quote, because they will oftentimes talk out of both sides of their neck and hope you're not listening. So let me tell you, in this same article, now remember, this is from May 7th of 2025. Alan Levine says, quote, TennCare hasn't changed hospital reimbursement in the state in 20 years. If you're getting paid 50% of your costs and you're a high Medicaid provider like we are, that creates a strain for everybody. Now listen, Alan Levine, the CEO of Ballad Health, said they are a high Medicaid provider. Did you all hear that? That's what he said in a statement to WJHL. Listen. Hold on, Chris. Let me get there in just a second, but you gotta let me do this part first, because I gotta string all of this together, and it's very complex, and I just want people to follow. So listen to what he said. I'm gonna screen share real quick on this side so that you all can see what he said in this article right here. So you all can see. Oh, come on, share the damn screen. It's doing it again. This is why sometimes Restream pisses me off, because, okay, it finally did it. Perfect. Okay, so look, you guys, right here, Levine says, TennCare hasn't changed hospital reimbursement in the state in 20 years. If you're getting paid 50% of your cost and you're a high Medicaid provider like we are, that creates a strain for everybody. Now, why am I pointing that out? Why is that significant? Because just this week, Tony Keck from Ballad Health said something a little different. Let me tell you what Tony said. So Tony decided to talk to WCYB. So WCYB back home is owned by Sinclair Group. Sinclair is a very right-leaning news organization that predominantly owns a lot of news in rural communities and rural areas. So you get their news. So Tony Keck, this is the title of the article that was yesterday, May 30th, 2025. Ballad Health speaks on potential Medicaid cuts as lawmakers fear hospital closures. So let me tell you what he said. So Tony Keck says, Tony Keck, who's the System Innovation and Chief Population Health Officer for Ballad Health, says, quote, right now the bill, in our opinion, it is pretty good shape for physicians and hospitals in Tennessee and Virginia. He says these potential changes may affect the 15% of patients that Ballad serves who are covered by Medicaid, but Keck says with Ballad's charity care policy, they should be okay. Now listen. Tony Keck says, only 15% of our population, our patients, are Medicaid. But Alan Levine just said they are high Medicaid providers. Do you all consider 15% to be high Medicaid providers? Because I don't call 15% high. Alan Levine said they are high Medicaid providers. Tony Keck just said it's only 15% of their patients. So which is true? I guess it depends on what agenda you're following, right? Because those two things are not the same. Now, you boys know each other. You've known each other for a long time. You guys have worked together in Louisiana and other places. Tony and Alan, you should have got your ducks in the row. I might not live there anymore, but I follow your asses so hard, about as hard as you all used to follow my social media. That's how far I follow y'all. Now check this out. It's not low. If Levine says that they are high Medicaid providers, how is Tony saying that it's only 15%? Because guess what? According to the state of Tennessee, the Tennessee Department of Health, there are in the counties that Ballad Health services, about 140,000 people that are covered by Medicare and Medicaid. Sullivan County, 21% of the population has Medicaid. Johnson County is 23.3%. Carter County is 22%. Unicor County is 21.5%. Washington County, it's 20%. Greene County is 21.9%. Hawkins County is 22.5%. Hancock County is 30%. Hamlin County is 23.1%. I don't hear that being 15%. I hear 5 to 15% difference in that. Do you all not hear that? Can I show y'all where I got the numbers? Because y'all know I have them, and I will put them in the link tree for you. But when you look at the numbers, I'm going to give you Southwest Virginia in just a second. I'm going to give you the numbers for Southwest Virginia in just a second. So I actually went and looked on their state websites to tell you the number of people who got the so hold on, I'm going to share it and then I'm going to show you. So watch. And no, he didn't say that. He said, so let me tell you Keck's thing. Here's what he said again. He said, these potential changes may affect the 15% of patients Ballad serves who are covered by Medicaid. So he is saying there's 15% of patients Ballad serves that are covered by Medicaid. But Alan Levine said, right, that they were high Medicaid providers. That's what Alan said. Right? So if I look, he said, if you're getting paid 50% of your cost and you're a high Medicaid provider like we are, that creates a strain for everybody. Now, Let me tell you, can I tell you what they said when they were applying for the COPA? Can I tell you what they said when they were applying for the COPA? Let me do that first. Before I show you where I got the numbers, let me show you what they said when they were applying for the COPA. This is from the Tennessee Department of Health's website. So, TikTok, here we go. I'm going to turn you around so you can see what I'm showing everybody else. So, if you look, let me make sure that YouTube and Facebook can see it. Yes, you guys can. Okay, great. So, right here, watch this. It says, in Northeast Tennessee and Southwest Virginia, payment rates remain lower because the local Medicare wage index is one of the lowest in the nation. With a payer mix for the regional health system that is approximately 70% Medicare, Medicaid, and Medicare Advantage care, this wage index serves as a fundamental regulator of healthcare costs. Wait a minute. So 70% of your payer mix is Medicare, Medicaid, and Medicare managed care? You said 70% is Medicare, Medicare Advantage, and Medicaid. So we're supposed to believe that of that, only 15% is Medicaid? When in Tennessee, 48% of Medicaid is children? How do I know that? Well, right here. This is how I know that. In Tennessee, what does it say? 1 and 2 children. 1 and 2 are children. That's what it says. Let me show you guys this so you guys can see it as well. So right there, it says in Tennessee, Medicaid in Tennessee, 1 and 2% are children. 1 and 2, which is 48%, are children. So you are telling me that Ballad Health said, hey, listen, 70% of our payer mix is Medicare, Medicaid, and Medicare managed care, right? Okay. Alan Levine says that we are a high Medicaid provider on May 7th. And then Tony Keck turns around yesterday. And what does Tony say? Tony says it may only affect the 15% of ballot servers who are covered by Medicaid. Well, which one the hell is it? I mean, could we pick a number? Could we pick a story and stick with it? I mean, I wish I was wearing my t-shirt today that says country, not stupid. Because I'm just asking. Right? The math ain't mathin'. Correct. Winn-Dixie, I'm going to go there in just a damn second. I got that for you too. So I want to talk about the next thing that Tony Keck. Well, first, let me show you the numbers. I'm going to put it in here because I don't want to keep going back and forth and going back and forth. But let me tell you where I got the numbers from. So in Virginia, I am at dmas.virginia.gov, which is Virginia Medicaid website. Yes, ma'am, I am. So Southwest Virginia has 42,098 people that are on Medicaid in that region. In those counties, let me just tell you, I have all of the numbers, but I'm going to give you percentages. Lee County, 25.7%. Scott County, 21.1%. Wise County, 24.2%. Russell County, 22.4%. Dickinson County, 25.1%. Buchanan County, 24.8%. Washington County, 17.9%. Smith County, 21.5%. Tazewell County, 21.9%. I don't listen. And Southwest Virginia, you already know how hard you are hurting because of the downgrades that they did to Holston Valley Medical Center and all of the downgrades that they did, even with quote unquote bringing Lee County back, right? You've lost services at Lonesome Pine. You've lost Mountain View, period. I'm just saying. So I know what you all said on your COPA application. And unlike many people, I know where to go on the Department of Health's website. I know where to go in your application and find out when you said what you said. And I know where to go for your quality reporting. I know how to read it, all of it. And I know how you make your overall system scores look good, because the majority of your hospitals have zeros with your infection rates and your quality scores because they don't have enough damn patients, because you send everybody to Bristol Regional Medical Center, Johnson City Medical Center, Franklin Woods, Sycamore Shoals, and Johnston Memorial and Indian Path, right? So then when you add your other 10, 12 hospitals to the mix and they have zeros, it makes them real shitty scores that other places look better. I know how to do math. Right? But we're going to walk through their numbers. I'm going to show you their numbers that they posted, that they submitted, that they have on their website. And then I'm going to show you their numbers and their scorings within CMS. And I'm going to show them to you live while I pull them up in front of your face, because I want you to see what they won't tell you. And Molly Luton, I'm going to show people that you flat out opened your mouth and lied to them when you said that your quality has been improving consistently in the last several years. It's not true. Not in any way, shape, or form. Not even close to true. So that's the first part. The first part is these Medicare. So let me just tell you this about Medicaid in Virginia. Unlike Medicaid in Tennessee, Virginia actually expanded Medicaid. We know that some of these cuts are going to be the most devastating for rural communities and different states. So let me show you what this looks like for potential impact. So give me a second, because while I find the right map that I have pulled up in front of me. What is this? Oh yeah, screw you, Tony. I don't want to see your face. Medicaid. Hold on, y'all. I have so many things pulled up. Ha! Here it is. Da-da-da. Right. Beach bum wannabe. Right. Okay. So I'm going to show you all this. This is from KFF. Because remember, I told you they cover the nation. And they do with regard to healthcare. So let me show you this. Whoops. Southwest Virginia. You are about to be really upset. So give me a second to flip my camera around for you guys. Let me make sure that these goes. See, y'all can't see it yet. Hold on. Let me make sure it did it. Oh, dear God. Y'all see the frustration I have because I need it to show what I need it to show? Yes, now you guys can see it. Okay, perfect. So let me show you what this looks like. So this is from KFF, and this is the estimated Medicaid enrollment loss from this reconciliation bill, right? By state. In Tennessee, approximately 5%, right, will lose the baseline. Percentage of enrollment loss from the baseline by 2034 is 5%. So the estimated enrollment loss, 75,000 people will lose Medicaid in the state of Tennessee. The low end estimate is 56,000. The high end estimate is 94,000. So that's 75,000 people in Tennessee that are expected to lose Medicaid coverage if this bill passes. Now look at Virginia. Jesus, you are going to lose 20%. 20% of the people in Virginia. Yeah, I'm dropping it in the link tree, Cam, like always. 20% enrollment loss from the baseline by 2034. The estimated enrollment loss is 309,000. The low end estimate is 232. The high end estimate is 386,000. That's Virginia. Folks, you have to really understand. Look at North Carolina. And I want you to remember that Ballad pulls from Northwest North Carolina and a little bit of this bottom part of Kentucky. Kentucky's at 19%. North Carolina's at 9%. But don't let the percentages fool you. The percentages might be small, but the number of people are higher because of the population. In North Carolina, 9% equals 300,000 people. So that's 300,000 in North Carolina and 300,000 in Virginia. So tell me again, and where do you think these 75,000 are going to come from? So folks, let me just share this with you. One of the biggest things about these Medicaid cuts, if you have Medicaid, because North Carolina is a purple state. So the presidency went red, but the rest of the state is blue. Yeah, it's going to devastate rural communities because these people then become self-pay, which oftentimes equals no pay, right? I'm going to put this in. Yeah, it's going to hit people in poverty. You got it, Vike. So I'm going to put this in the link tree and what I want you to do is there's a lot of information in here. Scroll down to this second map. It's figure number 3. Okay. All right. So TikTok, let me turn you around and put you back over here. It makes me angry that these folks, that Tony Keck took his ass onto WCYB and said, oh, I think this bill is going to be just fine. Tennessee's going to be okay. I don't know where some of y'all went to church. I don't know what Bible some of y'all read. I don't know what spirituality some of y'all practice, but 75,000 people losing access to health insurance, that's not being okay for me, right? I know it will, witch, right? So that's the thing, Cindy Green. So that's the thing. So let me explain to you all this. So with Medicaid tops out when providers get reimbursed for Medicaid, they are getting reimbursed somewhere between 50 to 77% for Medicaid. Okay. If that person is under Medicaid expansion, that reimbursement rate goes all the way up to 90% because it's coming from the federal government. And the Affordable Care Act, right? Medicaid expansion took that up to 90%. But when they are talking about these cuts, they are talking about getting rid of that federal match, that federal mandatory repayment. Yeah. Ask Dominic to get it for you, baby. It's right up there. I don't know if you can reach it. If you can't reach it, Bella can reach it probably. So this is the point. If these states lose that 90% coverage, and these hospitals go back to only getting 50% reimbursement or 77% reimbursement, those hospitals are going to start cutting services. They are going to start closing. Providers are going to stop taking Medicaid, right? When hospitals cut services, what are the first things they cut? They cut birthing centers and they cut OB care. It's the first thing to go because it's so expensive. Oh, I don't know, Super Dave, how much it will cause everyone's insurance premiums to go up. I don't know. I haven't looked at any numbers regarding that, right? But I am telling you all, right, Mary, it will also impact jobs, 100%. So this is the thing that bothers me. When the CEO of Ballad Health sat down with WJHL at the beginning of the month, he says, remember y'all, what did he say? He said, when you're only getting reimbursed 50% of your cost and you're a high Medicaid provider like we are, that creates a strain for everybody. What did he talk about? He said it impacts the community's economy because those are good paying jobs for people. He literally described where I'm from. He described Kingsport. He described Bristol. He described Johnson. He described Southwest Virginia. Ballad Health is the largest employer for the entire region. So if, like Alan said, they are high Medicaid providers and they get things cut, then you tell me what happens. And then you're going to send Tony Keck onto WCYB, a different station, to claim the opposite, to say, hey, we've only got 15% of our patients who are covered by Medicaid. So, we're going to be just fine. Tennessee and Virginia, he literally said, right now, the bill, in our opinion, it is pretty good shape for physicians and hospitals in Tennessee and Virginia. So here's my thing. Why the fuck do you even have an opinion? That's what I want to know. Why do you have an opinion? And why are you going to the press about a political opinion? Shouldn't you be focused on your fucking hospitals? Shouldn't you be focused on your mortality rates and your readmission rates? Why are you talking about this? And why should I believe you, Tony Keck, right? Let me tell you who else says differently, okay? So first of all, if I look at the Commonwealth Fund, federal cuts to Medicaid could end Medicaid expansion and affect hospitals in nearly every state. Let's go to the next organization, the Center on Budget and Policy Priorities. Medicaid cuts would reduce access to health care for entire communities. Let's go to another one. Oh my gosh. Congressional Republicans can't cut Medicaid by hundreds of billions without hurting people. Why should I listen to you, Tony Keck, when all the experts who know this and listen, I believe them. Do you want to know why? Because I catch Ballad Health in way too many lies. So that's why I'm not going to believe you. I don't believe you. Because, well, hold on. I'm going to really tell you why I don't believe y'all. So let's just do this. And I wasn't going to, but it popped up in my soul. So I'm going to do so now. So I want to show you guys a little something. Give me a second. Now, I'm going to show you why I am through with these people. Whoops. Thank you. Can I do, we'll just do the last filing, not their audit, because you don't have your whole filing up yet. Okay, so we're going to do the 2023 Form 990 for Ballad Health. You ready? So let me give it to you. And the part that I want to show you, just give me a minute. Let me see if Tony is paid out of Ballad. I believe Tony might still be he is. Okay. Can I show you all something? I want to show you all something. Yeah, I don't have to forgive any of that. I don't have to. You don't have to ask me for forgiveness for your candor, Drew. I'm with you. Which, by the way, I saw your text. I don't know if you heard me say this yesterday. I am horribly behind, and I don't even know what I could do about it. But I will take a look at it. Let me show you guys this. Right? I can see them. All right. So listen, this, folks, is what's called a Form 990. Did you know that if it is a nonprofit, their Form 990, which is their nonprofit tax return, is available for your review online? Did you know that? That is a thing. Now, let me just make sure that you all can see it. Yay, you can. Okay. All right. I'm going to turn you guys around so that you can see what I'm showing those guys. So remember, this is Ballad Health. This is Alan Levine, the president and CEO of Ballad Health. This is his $3.6 million salary with also some additional revenue of almost another $250,000. So you are talking over $4 million for this CEO. Now, I want to take you down here to Mr. Keck. So this is Tony Keck. And let me just do it like this. Tony Keck is sitting at $837,000 and has additional income from other companies that are related of $91,000. Right? But this is their chief nursing executive, $684,000, right? I'm not looking at doctors. Now this is Steve Kilgore, not Terry, Steve, right? 800 grand. Now Tim Belisle hasn't worked for them since July of 2022, but he still got $800,000 for fiscal year 2023. Fiscal year 2023 begins July of 2023, July of 2022. So for the whole year, he was their general counsel, but he left the beginning of the fiscal year and got paid his whole annual salary for the year. I still don't know why their general counsel left, and it was a quiet departure. I didn't even know that shit happened until I was looking at their Form 990s. And now he's doing some kind of home improvement something, but he still got that 800 grand. Sure enough did. Yeah. There's a lot of them. These executive vice presidents, this is Eric Deaton. He's at 1.3 million. Lynn Krutax, the CFO. Oh, Lynn's leaving, as a matter of fact. 1.2 million. Marvin Eichhorn, EVP. He's at 3.1 million. Yeah, I know that's his severance. This is Pam Austin, Senior VP, 500 grand. Now, I want you all to remember that this is a region that has anywhere from 17 to up to 30% poverty, depending upon where you are in the region. That's what this region is like. If you don't work for the hospital, well, it depends, Blue Honey Pot, where you are. Southwest Virginia can get higher than that. I know they're astronomical for there. I know, which I'm aware. I know how astronomical they are. And they have only gotten higher every single year. So let me just see.
What was that? What is that?
So yeah, so it depends. When you break it down and do it by county, it's different. Northeast Tennessee averages out to be 15% or 15 to 16%, and that was back in 2022. But that's also because of the university and Ballad. But when you get out into Johnson County, Hawkins County, Hamlin County, Hancock County, when you get over into Southwest Virginia, there are 25%, 30%, all of that. Real talk. All right. So it's important for people to know what things look like. Now, I want the other big part that I wanted to show you, because I think that I have shown you all the discrepancies in Ballad Health's leadership's comments, correct? Do we all agree that what Alan Levine and Tony Keck said are not the same thing? Do we agree? that one of them said they have a large patient population, a high population of Medicaid patients. And the other said it was only 15% and they would be fine. We agree that they are not saying the same thing. So my question would be, why do we care? Okay, great choice. Send me a DM. Okay, so why is that important? Because you got to ask yourself why. What's the motivation behind that? So when it comes to the terms of certification, you want to look like you are taking care of a ton of poor people. You're not being paid correctly. Financially, things are really rough, because then you get terms of certification that are favorable for your corporation. But when you want to cozy up to politicians like Bill Lee and Rick Scott and Donald Trump and RFK, you come out in favor of a big bill. That's just the truth. I have been telling you all this for the longest time. They are aligned, people. And I know that you all believe that Christianity aligns with Republican, and that's the only way that you can vote. But what I am telling you is that the folks within Ballad Health are aligned with the folks that are passing legislation that will devastate you, devastate your hospitals, and devastate your communities. And I was right about it in 2018 and 2019, and I'm right about it right now. Not because I say so, but because the data and the resources and the experts say so. This is not about Democrat and Republican. This is about your family. This is about your life. This is about your health and your well-being. That's what this is about. Now, the other part of it that I want to tell you about really quickly, where Alan talks about being so committed and how they have really stepped up a notch when it comes to this quality thing with the new terms of certification. Let's talk about that for just a moment. So first of all, that 40%, okay, so let me just tell you this. They used to have to get a score of 85% or higher to be considered a clear and convincing benefit to the public. Okay. So while it only accounted for 20% of their score, they had to score 85 and above to be a solid, yes, you're a clear benefit. So now they said, oh, well, now your quality is going to account for 40%, but you only have to score a 70 or better. A 70. That's all you need now. So we're going to make it count for more, but you only have to meet less. And we're still going to give you some freebies. How about that? So do you really think this was about improving quality of care for people? Do you truly think that this was about things being for your benefit? Do you really think that that's what this is about? That we listen to all of the complaints and we want to do better, but you lowered the score. Now, let me just say this. This was a 10-year agreement. We are in year 7. After 7 years of being a medical monopoly in a region that is geographically the size of New Jersey, that has 1.1 million people in it, and you are surrounded by at least 5 different nursing programs, right? Should we be lowering the damn scores for you, or should we be raising them after 7 years? After 7 years, when you haven't had to compete against a damn soul, why do you need your scores lowered? And then it says that the Department of Health, they can adjust it by an additional 5% one way or the other, depending upon information that they get, which means Ballad Health could score as low as a 65 and still be considered clear and convincing evidence that they are doing just great and they don't have to be worried about being broken up or whatever. The Department of Health has been useless. Now, in addition to that, here's the kicker. Are you ready for it? If you did not think that it could get any worse, it has, and it is, and I'm going to tell you what it is. Are you ready? You want to hear it? Here it goes. So over the years, Ballad Health and the Department of Health has changed the baseline on which Ballad is scored. Okay? So it has changed at least 3 times that I'm aware of since the COPA was granted. So that baseline score is what they have to meet or improve upon every year. Okay? Well, the Department of Health said, we're going to change that. We're going to set new baselines to score you by. Guess when they're going to tell the public what the baseline scores are? In 2 years. In 2 fucking years. In 2 years. There's only 3 years left on the contract. If you're going to wait until the last fucking year, why even bother? All you are doing is kicking the can down the road until you can get to the end of this contract, sell us the fuck out, and take all your cash and diddly off. That's all you're doing. You are kicking the can down the road for 2 years until you can sell off our hospitals, close our hospitals, take your big ass paychecks and get out. That's it. How do you love that? Now I want to show you why Molly Luton is a liar. Hi, Molly. How you guys doing? So I'm going to share my screen. TikTok, I'm going to turn you around so that you all can see. I am on CMS Medicare.gov Hospital Compares website. Okay. You ready? So you all can see, whoops, I hit my keyboard. You all can see where we are, right? Let me make sure they can. Perfect. Everybody can see. Love it. Now watch this. I'm going to type in the zip code of my hometown, 37620. And I'm going to do a search. This is Wellmont Bristol Regional Medical Center. It is now a 1-star hospital. Before the merger, before the COPA was granted, they were a 4-star hospital. They were a 4-star hospital. They are a 1-star hospital. And they have been for a while. Now, what does that mean? Let's go under quality, because they said, Molly Luton said, they have been improving quality for the last several years, right? So I want to go to complications and deaths. So deaths among patients with serious treatable complications after surgery is 21.98, and the national result is 176.55. Now, I don't pay attention to whether it says no different or worse, and the reason why is scores aren't the same. Scores don't get that same classification for every hospital, so I focus on the number. So the national number is 176.55. Bristol Regional is 210.98. That's their rate. So these are patients that had serious but treatable complications, and that's their rate of unaliving. The infections, they've gotten them pretty down and under control because they used to suck. I'll show them to you. But this is the one I care about. Do y'all see what this is? These are the unaliving rates. So the unaliving rate for heart attack patients, the national result is 12.6%. Bristol Regionals is 15.3%. The unaliving rate for heart failure is 11.9%. The national result. Bristol Regionals is 16.5%. The unaliving rate for pneumonia patients nationally is 17.9%. It is 23.6% at Bristol Regional. What does that mean, people? That means that almost 1 in 4 patients that are admitted into Bristol Regional Medical Center for pneumonia, they unalive within 30 days of discharge. That's what this means. That means that 24%, so almost 1 in every 4, unalive within 30 days after being admitted for pneumonia at this hospital. Let me show you what readmission rates look like. So rate of readmission. So this is when you are readmitted for the same condition within 30 days after being discharged. This is hospital-wide. The national result is 14.6%. They are 15.7%. But by medical condition, readmission rate for heart failure patients, 19.9% for the nation, 23.7% for Bristol Regional. 16.4% readmission rate for pneumonia patients, 18.5% for Bristol Regional. And now I want to show you their quote unquote flagship hospital, which is Johnson City Medical Center. Johnson City Medical Center is also a 1-star hospital. Elizabeth, Holston Valley looks different because I'll do it, but they look different because the patient numbers are a little bit different there. But this is a 1-star hospital. So let's look at complications and unalivings. Their rate among patients with serious but treatable conditions after surgery is 224. Remember, Bristol Regionals was 210. This is 224.98, and the national result is 176.55. Come down. I don't know what the hell is going on with people that have colon surgery, but surgical site infections from colon surgery, they are twice the national benchmark. The national benchmark is 1.000. They are 2.4. They are more than double the national benchmark for surgical site infections from colon surgery. Their unaliving rate for heart attack patients, 15.6%. The national result is 12.2%. Their unaliving rate for heart failure patients is 16.2%. The national rate is 11.9%. Their unaliving rate for pneumonia patients is 21.9%. So again, more than 1 in 5, almost 1 in 4 patients that are admitted unalive within 30 days if they're admitted for pneumonia, because the national result is 17.9. Their unaliving rate for stroke patients is also scary. It's 18.5%. The national result is 13.9%. I'm aware. Yep. If you are readmitted within 30 days for the same condition, Medicare will not pay, and they shouldn't. These are the readmission rates. For heart attack, 15.2%. National rate is 13.7. Readmission rate for heart failure at Johnson City Medical Center is 20.4%. National result is 19.8. Readmission rate for pneumonia patients, 18.2%. National result is 16.5. Readmission rate for CABGs is 12.5. It's 10.7 nationally. I could go on and on. I will put the link to this so that you can search for your own hospitals. What I will also tell you is that Holston Valley Medical Center was down to being a 2-star. It's now back up to being a 3-star hospital. However, Not Indian Path, but Johnston Memorial, which used to be 3 stars, is now down to 2 stars. Sycamore Shoals also used to be 3 stars. It is down to 2 stars. So these 2 hospitals have fallen down to 2 stars, and Bristol Regional and Johnson City are 1 stars. And those are their most prominent hospitals. Okay. So that's from Medicare. Now I want to show you what the hospital safety grade looks like from Leapfrog. All right, perfect. Right, Ethan. All right, so let me show you right here. So this is Leapfrog hospital safety grade. We are going to search by zip code. Whoops. I'm going to put in my hometown again. And I'm going to show you that Bristol Regional Medical Center is a D for the spring of 2025. This is their latest score. Now, Molly Luton, you said that quality has been improving. Well, look, you can actually show recent past grades. Let's click that and see what happens. Uh-oh. In 2023, they were a C and a C and a C, and then they were a D in the fall, and they are a D again in the spring. It doesn't look like they are consistently improving quality, does it? Let me show you where they do worse. They do worse with MRSA infections. The best hospital score is 0. The average hospital score is 0.7. Bristol Regional is 1.1. Problems with surgery, dangerous objects left in the body, they do worse than the average and the best. They do worse, the unalivings from serious but treatable conditions. Blood leakage, they also do worse. Safety problems, patient falls and injuries, they do worse. I know MRSA's contagious. Dangerous blood clot, they do worse. Now, here's the part that gets interesting. Practices to prevent errors. Doctors order medications through a computer, they do worse. Safe medication administration, they do worse. Hand washing, they do worse. And does the staff work together to prevent errors? Decline to report. So what does this mean when there's an asterisk? If you go down here, the hospital declined to report their performance on this measure, so a score was assigned to reflect the lack of information available, and they draw it off of records, like publicly available data. So let's go back, because Molly said, right? Molly said that they are consistently improving quality. Well, Molly, I want to see. Molly, if you are consistently improving quality. So give me a moment. Let's do Johnson City Medical Center, which is also a D, which happens to be their quote unquote flagship hospital, right? What are your recent grades, Johnson City? Your recent past grades? You didn't even get graded last fall. You were a C and now you're a D. So CCs, DDs, C, not graded, and D. Wow, look at that. Infection in the blood, you do worse than the average and the best. Surgical site infection after colon surgery, that's the one we looked at, also significantly worse. Look at that. Their score is almost 3. The best hospital score is 0, and the average hospital score is 0.8. Theirs is damn near 3. And the worst hospital scores was 3.094. They damn near got the worst. Problems with surgery. Surgical wound splits open. They are double the best hospital score, which makes them worse, right? Unalivings from serious but treatable conditions, significantly worse than the best hospital score. Kidney injury after surgery. Their score is 2.5. Best hospital score is 0.7. The average is 1.69. Now, y'all, I want you to remember that these folks put out ads in their community claiming to be among the nation's best. Don't forget that, please. Safety problems. Oh, y'all did okay right here. Look at that. Practices to prevent errors. Well, hell no. Y'all just really worse across the board right here. Yeah. So let me just show you something. Ballad Hospital is a D. Ballad Hospital is a C. Now, this is Johnson Memorial. Let's look. They're a C now. What did they used to be? They've been a C for the last few years. Daisy Girl, we can talk about that. Right, which and billboards. I don't see improvement here. Do y'all? I don't. Let's go back and let's look at Sycamore Shoals, which is also a C. Let's show your past recent grades. I don't see any improvement. Do y'all? Nope. Let's go over here. Let's just, I don't know how Franklin Woods is a damn C. That just gets me. Look, Franklin Woods used to be B's and A's, and now they're a C. Hey, Molly, that is not improvement. That's actually worse. Molly, that's not good. Practices to prevent errors. Look. And I'm not laughing because it's funny. It just irks the absolute hell out of me. Indian Path. You were C. What did you used to be? Ah, you were a B. And look. C, 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 C. Right? Holston Valley. Whoop. Let's confirm. Oh, I am human. Choose all the clocks. Because I'm clicking all this shit. They said, wait a minute. Are you a person? I am. So Holston Valley, no improvement. You just C's across the board. Watauga is not them. Clinch Valley is not them. Greenville is them. So Greenville Community East. Oh, C's, D's, and a C. So why am I taking the time to go through absolutely every ounce of this? So those are two different sites. One site is the CMS Hospital Compare site. The second site is the Hospital Grade site. Elizabeth Sweeney, in my profile on Facebook, on YouTube, and on TikTok, there is a link tree there. All of these links will be put into a collection. It will say Ballad Health in the collection of documents. All of the things that I have discussed tonight, all of the things that I have showed you, I will put every single one of those links in that link tree for you to be able to access them, to look up your own hospitals, to look up your own sites, no matter where you live. No matter where you live. We have the largest state-sanctioned medical monopoly in the country. And we're not the only one that has a COPA. In addition to that, folks, healthcare is a problem everywhere. We have way too many hospital mergers, way too many hospital acquisitions. We have way too many big hospitals that are eating up small hospitals, that are getting rid of providers, that are bullying providers to either play the game they want it played or not get privileges at their hospitals. It is time to shake this up. Let me tell you something. I do not condone violence. I don't condone violence at all. What I will absolutely say is that I understand how people get to that point. I understand why people end up rioting. I understand why people like Luigi do things. I understand. Because the systems are rigged. The systems are not working for you. The systems are working for the rich and the corporations. The systems are not working for you.
Actually, 5 people.
Rifleman USMC. I don't think that that's even in the same line of what I'm talking about. Because that was not a riot. That wasn't a riot at all. It wasn't a case of response to injustice. That's not what it was. And you know that. I don't know why you just want a little attention, but I gave it to you. I hope you feel better now. Folks, I have been begging you, the people of the region, hi baby, for a long time to choose elected officials who are going to do right by you, regardless of their political party and political affiliation. Elect people that are going to pass legislation for your benefit. And these people aren't. They're not doing it for your benefit. Yeah, I mean, at this point, we should all know that the Department of Health is on the side of Ballad Health, period. In my personal opinion, I have no idea about the legalities of it and the statutes of it, but in my personal opinion, I think that the people of Northeast Tennessee should sue the Department of Health. I really do. In all the times that Ballad has been found guilty of violating laws and regulations, which they were, I've got a letter stating so. They were found to have violated laws and regulations when Jeremiah Fields was unalived at Holston Valley. And in all the times that has occurred, they have never ever fined Ballad Health. They have never given them any kind of remediation. They have never taken any actions to penalize them for the damage done to the community and to the population, and they should. That's their responsibility. And they haven't. My point is, y'all, they are lying to you about the dangers of the cuts to Medicaid for the region. They are lying to you. And they will absolutely, as soon as they have hardships, they'll blame it on the cuts to Medicaid and they'll say, oh, we didn't see it coming. Oh, we thought it would be okay. We were listening to the politicians that told us what it was going to be, right? We didn't know this was going to happen. They sure will. And it's all horseshit. I showed you tonight, beyond a shadow of a doubt, where Alan Levine and Tony Keck said two completely different things 3 weeks apart. One to WJHL, the other to WCYB. I am going to put in this link tree, in the collection, I'm going to put every article that KFF Health News has done in the last 2 years. I'm going to put them in there. If you really want to see, what it looks like. And I'll show y'all one more thing. How about that? Before we get out of here, I want to show y'all something. Give me 1 second. I'm going to show you guys something. And I have to update it. So this is not updated at all. But let me pull you guys over here so I can turn you around. I thank you all for gifting, liking, sharing, doing all the things. Ooh, careful, baby. Careful. Okay. Give me 1 second. I want to show y'all something. So this is my personal spreadsheet that I put together for Ballad Health. This was the original baseline. This is the first time they updated it. This is the third time they updated it, and now they're going to update it again. But do you see all the red? This is their performance for their target quality measures over those years and whether they're supposed to increase or decrease. All the red is them failing. I haven't updated it since this would have been fiscal year to date 2024 July through May. So this would have been through May of 2024 was the last time that I updated these numbers. So you can see that they had failed 64.7% of those target quality measures. Their quality monitoring measures, they had also failed 61.5% of those, right, a year ago. These are their access scores as well. Not only did I do them for here, but literally I've done them by individual hospital. Their quality priority measures. There are very few people that know Ballad Health and the real deal about them the way that I do. And I'm going to tell you something. They have said a lot of stuff about me over the years. None of it having been true. Not a dime of it. They tried their best to muddy the waters and say I was being paid to be there and I was lying and I wasn't telling the truth. And everything that I've said has been proven to be true. Every single thing. Oh, I know they're watching Michelle T. I know it. Hi, Alan. Hey, Tony, by the way, I still have screenshots of our Twitter conversation, Tony, just so you know. So let me say this, okay? Yeah, 100%. That's the effect of the pool, y'all. This all started. Thank you for the gum. So let me just tell you all, for those of you all who follow me for a long time, you know how this started. You know this started because my daughter gave birth at Holston Valley Medical Center, same place I gave birth to her at. She gave birth to Bella in August of 2017. Bella was 1 pound, 3 ounces at birth. If you count all of her like tubes and stuff, she was 1 pound, 4.5 ounces. She was 26 weeks. From head to her butt, she fit in the palm of my hand. She had little bitty legs to suck at. Her skin was so thin that you could see her heart beating through her skin. And Dr. Powers and Dr. Tanvir and Dr. Martin and the NICU nurses and the respiratory therapists did an incredible, phenomenal job at that NICU saving her life. We have her, and she's amazing and beautiful and smart and brilliant. And a year later, a couple of the nurses reached out to me because they had heard rumblings that they were going to close the NICU that saved Bella's life. And at that time, I had a social media following, but it was nowhere near what I have now, right? And they just said, we don't know of anybody that could bring attention to this, that could do something. You're the only person we could think of. And they said, we don't know. And at that time, I didn't know anything. I didn't know anything about a COPA. I didn't know anything about CMS, hospital compare websites. I didn't know anything about hospital safety grades. I didn't know anything about any of it, right? And it was real simple. I said, I'll do whatever I can. And in 5 days, I found out just how corrupt, how shady, how horrible, and how dishonest these people had been putting this COPA together. They had lied to the public. They had maneuvered politicians. They had done a lot. And after 5 days, I was so angry at the fact that they took advantage of people that trusted them that I was all in at that point. I had no idea that I was going to end up leading protests and creating community events and having 400 and 500 people show up at the COPA hearing. I had no idea. I was going to end up moving back to the region. I damn sure did not know I was going to grab a backpack and a sleeping bag and go sit outside of Holston Valley Medical Center. And I had no idea that there were going to be people in that community that came out there to be with me, and that we stayed there for 257 days straight, 24 hours a day, 7 days a week. I had no idea any of that was going to happen. I didn't know that they were going to try to make me a felon for dead grass on the public right of way. I didn't know they were going to try to, say I was disrupting the hospital. I didn't know any of that. Jerry Qualls, I love you, and Kathy too. I had no idea. I didn't know we were going to get almost 30,000 local signatures on written paper and take them to Congress, take them to the FTC. I had no idea that the people in the FTC and the chair of the FTC were going to know who I was by name and by face. Right? So sitting outside of Bristol Regional Medical Center came to an end January 13th of 2020, simply because I got a nudge in my gut that it was time to pack it up and go home. We were out there from May 1st of 2019 until January 13th of 2020. And it was a lot. But I knew that we could continue the work no matter what, right? We didn't have to be outside of the hospital to do work, right? And it was so great that we did, because what happened immediately after that was COVID. Literally, we packed up camp January 13th of 2020. I said, y'all, I just feel it in my gut. We need to pack up and go home. And right after that came our first few cases of C-19 in March. So what I have learned time and time again is to trust my inner wisdom, to trust my gut, to trust my nudgings, right? Because they don't fail me, I truly believe that we can come together and create something different that is for people. I believe that we can stop penalizing and criminalizing people for being poor. I believe that we can start living the qualities we say we have. I do. I believe that we can be the greatest nation in the world, even though we aren't today. I believe that we can be. I don't know what all it's going to take for us to get there, but I believe that we can. And I think, belief is half of it. Belief is half of it. Stop letting these people lie to you, and stop thinking you can't do anything about it. Yes, you can. Yes, you can. Write letters to the editors. Talk about this story. Talk about what's happening here. Every healthcare publication, every mainstream media should be talking about the state of Tennessee's Department of Health being in bed with the medical monopoly that they created at the detriment of people. Every single one should be talking about this. They should be talking about healthcare systems and monopolies misleading people, giving them misinformation that is dangerous to their health and well-being. Everyone should be talking about it. Appreciate you. Everyone should be. So and babies were in the pool all day today. She was out there and she didn't realize that her little life jacket had rubbed the inside of her legs. So I put a big t-shirt on her and put some neem oil on her little places so she could heal. And we're just going to look. She knocked out with her mouth wide open. Y'all, this is when you done. Anyway, it has been a year since we lost Dr. Powers, who was one of Bella's primary physicians that took care of her. PJ Powers. He passed right before my birthday and Mother's Day last year on that Saturday. And we were so blessed the week before that somebody had reached out to us and let us know that he was that bad in hospice, but that his son was playing and reading messages to him. And so I had Bella record a video message for him, thanking him for saving her life and telling him how well she could read and all the things. And then Mila wanted to record one too. And she told him, thank you for saving my sister's life. And so we sent those the Thursday before. And he passed on that weekend, you know. We lost him as a physician in the region. We did. It hurts my heart to know that because they closed the NICU at Holston Valley, and the only neonatal intensive care unit they have now is at Johnson City Medical Center. It's at Niswonger's Children's Hospital. It hurts my heart to know that they are like licensed for 36 to 38 babies. And I know for a fact there have been as many as 57 babies in there at one time. You can't possibly, those babies cannot possibly be getting the same level of care that Bella got. They can't. There's just no way. There's no way that you can have 57 babies in a place that should have 38. I know that there are babies that have been 3 and 4 babies to one nurse when it's supposed to be 2 to 1 or 1 to 1. I know that for a fact. I know we lost Alicia Gaddy, who was a neonatal nurse practitioner. She left. It makes me sad. It makes me sad that, because I know what it's like to be that family. Y'all, if you've never had a baby in the NICU, you can't hold them. You can't feed them. They told us when we were finally allowed to touch Bella, they said, we're not allowed. They said, don't rub, because her skin was so thin. If we rubbed it, it would have ripped. They said, just tap when we were finally allowed to touch her. You rely on those people for everything. To feed them, to talk to them, to comfort them. You just rely on them for everything. I will forever be grateful to Donna and Suzanne and Heather and Rhonda and Kayla and Amber and like I can name, and Brenda I mean, there's so many, Candace. There are so many of them. And my heart breaks for them as well because, when you do that kind of work, you do it for the patients, you do it for the patients. So even if it's understaffed and overcrowded or any of those things, it's like, do you practice in unsafe conditions, or do you leave patients and your family to be a travel nurse somewhere else? Like, what do you do when they're the only game in town? What do you do when they own all the hospitals? And if you leave one, you can be blacklisted and not get to work anywhere. Right? Thanks, Sandy. Thanks, Brandy. People have asked me, do I regret doing the protest? Especially because there are people back home that have said really nasty things to me because now they've figured out that I'm progressive in a lot of my views. And I don't really think that I'm progressive. Y'all, I don't think that wanting healthcare for everybody is progressive. I just think it should be. I don't think wanting to end poverty and have really, really rich people pay their fair share is progressive. I don't think that's extreme. I just don't think it's extreme. It's what I wanted for you. It's exactly what I wanted for you with Ballad Health, right? I wanted you all to have great health care. But people have asked me, especially some of my friends have said, girl, how do you feel, now that some of the people say the things that they say to you and about you? Do you regret it? And the answer is no. And the answer is, even knowing everything I know now, I would still do it again, Did y'all hear that baby snore in a sigh? Anyway, I know that this was a lot of information and I still glossed over so much because it is so dense and it is so complex and intertwining, right? But I think I said enough for everyone to get the gist of it, to know the differences, to know where to find stats and all of that. I'm going to ask one thing of you all. Be patient with me. Give me until tomorrow morning to put everything in the link tree. Because as you can see, I got really sleepy babies. One over there that's just running her jaws to stay awake, right? Appreciate you, Kimberly. Good. Yeah, Drew, I don't know how Alan takes $4 million in salary. I just don't know. Yeah, so let me tell you, here was my plan. My plan was take the kids to the pool all day today, right? For a good piece. By the way, I cooked for them. I grilled out. First of all, I cooked breakfast for the babies today. Some pancakes and some cheesy eggs and some bacon for them, right? And then I spent some time and got everything together and seasoned up some hamburgers and seasoned up some chicken and then some hot dogs and then did some baked beans and some deviled eggs. And then I sauteed some cabbage and broccoli and squash all together. and made the deviled eggs, right? And so loaded everything up, got my niece and her daughter and her boyfriend, and we all went over to the pool, and I fired up the grill out there and cooked the meat on the grill and all that for everybody. And the kids were in the pool. And so the plan was for them to come home and be knocked out. And I'll be damned if Bella ain't still awake. And it took her forever to go to bed. I just knew I was going to be able to get on at 8:30 and these girls were going to be knocked out. But you see, they tried my soul at the beginning of this live, didn't they? They tried my soul. Yeah, Elizabeth, you're more than welcome. And if you go, so Elizabeth, if you go to on Facebook, there's a group called Citizens Advocacy Ballad Health. If you go in there, you will see numbers for the past several years that I've put out like every quarter for Ballad. 100%. Yeah, poet, we did it. Nope, girl, I ain't have no time to do no potato salad. Nope. But I did do baked beans. Listen, I have to tell y'all this before we go. So at one point, they'd been in the pool for a while, and Mila got out the pool, and my niece had just fixed me a plate of some beans, right? Some baked beans. I said, I just want a little bit of baked beans, right? So she fixed me a plate with some baked beans on it, and Mila had come out of the pool, and she said, I want some of that. And I said, what? I said, you want some more food? And she said, yeah. And I said, you want a hot dog? Because Bella had just had one. She said, no, I want some of that. I want some of yours. And I said, okay, baby, you can have some beans. And she sat down beside me. And so I took my fork and I gave her some baked beans, and she ate off my fork. And then Mila reached out, took my fork from me, and proceeded to eat all the beans on my plate. I just put it in her lap. She sure did take my fork and took right on over and ate all my food. And then she came back home and asked me for some more beans. I said, I must have put my foot in damn near everything. Bella ate the chicken and she said, can I have the rest? It was cute. It was cute. So they had a great day. Yeah, both feet. Both feet. My daughter's boyfriend tasted the hamburger and he said, what'd you season this with? Listen, it's more than a last name, y'all. I can cook. Listen, she calls baked beans green beans, knowing good and damn well they're not green. But every bean is green. Every bean is green. Right, Stacy? I seasoned it with my soul. But okay, it is 11 o'clock. I said 3 hours, but you only got 2.5. I am going to take these kiddos and lay down and lay them down and lay me down. My back said, take yourself somewhere and lay down. I love you all so much, Stacy D. And I have your text. And the answer is yes, we will make that happen. You going? Where you going? Yeah, I love you guys. Mean it. I will put all the links in there tomorrow. I will be live tomorrow. I don't know what time yet, but I will post it in Discord and on Facebook when I know the time. Okay. So, I love that for you, Renee. I do. Dancing for 3 hours. Yeah, Valerie, I'm glad you got to as well. Love you guys. You guys have a good night. Hold on to hope. And at the same time, hold people accountable. We can do both. We can do both. We can have hope and we can hold people accountable. And that's what we got to be about the business of doing. Okay. Good night, everybody. I appreciate you very much. And I will talk to you later. Love you guys. Good night.